George Crawford, a general surgeon in Anniston, Alabama. I'm also on the board of directors of Regional Medical Center.
Hi, my name is Dr. Almina Free. I'm Vice President of Medical Affairs at Stringfellow Hospital and Regional Medical Center. I'm also Chief Medical Officer of both hospitals and a hospitalist.
For Alabama, it essentially stems from the Tuskegee experiment, where they were testing and treating and not treating syphilis to see what happens long term. I think people always say, oh, that was in the past. The problem is that some of the people that live in this area have grandparents that were alive during that time. So when your grandmother or your grandfather is always saying, don't trust a doctor, don't go to the doctor because they're doing X, that over time breeds generational distrust to the medical community. So, I get it. I'm not from Alabama, I'm from South Carolina, but, we have that same history as well with gynecologists and learning how to do some of those early experiments on slaves. I think one of the things that's for me is the most important is that, one, I've been in medicine for 20 plus years. I went into it with some hesitation and reservation, same reason everyone else has a reservation about the virus and the vaccine. Over time, I've kind of learned that once you acknowledge that history, you then can move forward. So for me, I have acknowledged that history, my medical professors have acknowledged that history, and it allows me to just kind of say, hey, okay, we know what we did, we know what they did, but we need to move forward and take care of ourselves. Because ultimately, at the end of the day, we have to be healthy in order to get to a point where we can turn that distrust into trust and spread that through our kids and our grandkids. So for me, I think it's really important to just kind of say, hey, yes, there was a wrong done, but we still have to remain healthy. And COVID and a vaccine has brought all of that to light.
The other thing that I just want to add, not so much in smaller areas, but so much in smaller areas, but in large places where black communities don't have access to care, or they have to catch a bus and then a train and then another bus. I mean, there's not that true access where people can go and see primary care physicians to assist with their care. For people that are younger, and in the younger generations, there's a distrust with doctors because they don't see doctors that look like us many times. And so when they go to a primary care physician or they go to the ER or urgent care, they may be shunned, or they feel like they're being shunned and they're not getting the proper care that they should, that the provider is not really interested in me because I'm a black person, or because I don't have insurance, or because I do drugs, or these kinds of things that marginalize our African American community. So that trust we have to overcome. And I know when we were doing the COVID testing, I would knock on people's doors in some of the housing communities that we visited, and the residents were fearful to come out. Oh, you're going to give me that disease. Oh, you're testing, but you're really going to give me that disease. You're not really interested in whether I have it. And no, I don't want this because, I don't want to know about it. I just don't want to know about it. And it's as if ignorance is bliss, but it really isn't. So we have to, even outside of the COVID, we as African American physicians, nurses, professors, we need to get out to the community to start teaching people, look, your health is very important. Whether you look at the outside or the finances, that's immaterial. You've got to take care of yourself. You've got your own children, you've got grandchildren, you've got cousins, you've got a whole environment of community folks that you need to take care of. The other thing I tell people, especially when I started practicing here, it was interesting because people would say things like, oh, you're just saying that. Oh, is it because I'm black? And I tell people, if I take a scalpel and I take a small slit and I pull the skin down from you and I do that on a Caucasian person, guess what? You look the same. So what we see on the outside is the exterior, okay, it's a phenotype. The genotype is still the same. We take care of people, and we just need to get out to the community to tell people, hey, we're here to help. You've got to take better care of yourself. You got to take care of your family, and this is something we've got to do.
And I think the biggest way that healthcare providers like myself and Dr. Free can reassure the African American population or any population is that we're taking the vaccine ourselves. You know, we're excited about taking the vaccine. We have read the data. We're not hesitant about it. We're not worried above and beyond that worry that everybody has when you're doing something new. But, you know, again, we're putting our faith in that medical community and we're going forward with it.